Our team is here to tell you a story about Finley Boyle, the daughter of Ashley and Evan Boyle. This past December 3rd, she went in for a routine dental procedure, which resulted in massive brain damage and death 1 month later. She suffered cardiac arrest, leading to severe and permanent brain damage, and was in a persistent vegetative state before her death. Her dentist was Lily Geyer at Island Dentistry for Children. Dr. Geyer diagnosed Finley with 10 cavities and said she needed 4 root canals. A different dentist examined her teeth while she was comatose and said she only had a few cavities. The family's attorney stated she only needed 2 teeth to have work done. Additionally, it has been determined that the x-rays that were done by Dr. Geyer were not clear enough to be diagnostic. Dr. Geyer is now under investigation by the Hawaii Department of Commerce and Consumer Affairs, and her office has been closed permanently. Dr. Geyer's staff received help from neighboring pediatrician Dr. Brett Reese. This doctor found Finley sitting upright, not breathing, and unresponsive in the dental chair. There was no audible heartbeat. Dr. Reese found that the dentistry staff had made no effort to assemble a resuscitator bag or give anything to counteract the sedatives. It is alleged that the dentist did not know how the medications would react in the child's body. She also did not know how to revive her or how to handle the emergency situation. Ashley Boyle, the child's mother, was only notified of the problem when the emergency responders arrived, which is unfortunate as her mother is a registered nurse. Finley Boyle weighed 38 pounds and, according to records, received the maximum dosage of Demerol and hydroxyzine, 40% more than the maximum dosage of chloral hydrate and nitrous oxide. As seen in this image, the Island Dentistry's records show there were 26 minutes where Finley's vital signs were not monitored. Her oxygen level was normal and had fallen to less than 65%. Pediatric dentistry guidelines recommend oxygen levels be checked every 5 minutes. This lack of oxygen to her brain led to her brain damage as determined by MRI and her eventual death. She died at Hospice Hawaii in Kailua on January 3, 2014.
All right, Finley, you ready to get started? You ready to get started? Okay. All right. We're going to start giving your medication now, okay? Got 5 to give you, so you're going to start feeling real sleepy. That looks like a lot. Okay. All right, first one's done. All right, second one. And the third. All right, the fourth and last one, sweetie. All right, that's a whole lot. Okay, should be nice and sleepy, okay? All right, gotta go schedule my movie tickets. I'll be right back, okay, sweetie? All right, sorry, sweetie, that took so long. Finley, you nice and sleepy? Finley? Finley? Dr. Geyer!
What's wrong?
She's not breathing.
Yeah, maybe we should call the pediatrician and let them handle this.
Okay.
What's going on?
I went to the restroom and came back and she's not breathing and...
Where's Dr. Geyer?
I think she took her lunch break.
Oh my God, call 911.
All right.
Finley Boyle was left unattended for 26 minutes after being sedated. She was also given improper medications and improper dosages. All this resulted in the child going into cardiac arrest, which left permanent and irreversible brain damage and eventual death. After sedation, a patient should be closely monitored for any signs of change or decline, especially during a procedure. Also, medications should be checked several times against the MAR, medication administration record, if one is available. Any dosages should be calculated a minimum of 2 times. This tragedy could have been avoided if a few people were diligent in their responsibilities for this procedure. One person could have stayed with the child after sedation to monitor her. The medication error could have been caused by something as simple as slip of the hand or grabbing the wrong medication. However, this could have been easily avoided if there were a minimum of 3 medication checks in place. This is where you check 3 times that the medication you have is the correct one for the patient. And if a MAR is available, you would use this to check against the medication and check for allergies. The improper dosages could have been easily avoided by calculating the dosages, especially child-appropriate doses, minimum of 2 times. This is a tragic story of a 3-year-old girl dying due to suboptimal treatment. These were simple errors of oversight and omission that could have been easily avoided, and since they were not, a little girl is dead and a family is grieving over their lost child. This really puts it into perspective how easy it is to make mistakes, even when going to the dentist. The main failures that happened to this child were the inappropriate dosages of sedation, incorrect combinations of medications, and failure of the dentist's response to urgent conditions. According to the American Academy of Pediatrics and the American Academy of Pediatric Dentistry, there are specific procedures that must be done in order to have a safe sedation of children for procedures. A current practice that takes place before sedation can occur is a health evaluation. The health evaluation includes the age, weight, review of systems that could affect the expected responses to sedation, normal vital signs, physical examination, and a health history, which includes allergies, medication and drug history, relevant disease, pregnancy status, previous hospitalizations, and family history. We can make assumptions that this did not take place because of improper dosages and the outcome of this situation. One important guideline that did not take place for Finley Boyle was that the sedation medication was given without a safety net of medical supervision. In Finley's case, the dentist was not able to revive her safely and waited for a pediatrician to safely address the situation. Another main procedure that is required, according to the American Academy of Pediatric Dentistry, is a clear understanding of the pharmacokinetic and pharmacodynamic effects of the medications used for sedation. Finley was administered high doses of sedation medication such as Demerol, hydroxyzine, chloral hydrate, and nitrous oxide. Current practices use nitrous oxide conscious sedation, or hospital general anesthesia, for the safety of the patient, as noted by Dr. Antonio S. Braithwaite and Dr. Brandon M. Knockham. It is recommended that children of ages 2 to 5 would most likely be suitable for conscious sedation. While the patient is under sedation, the proper observations must take place: patient's responsiveness, color, respiratory rate, and rhythm. The practitioner should also document the name, route, site, time of administration, and the dosages of all drugs that are administered. Unfortunately, when Finley was under sedation, the only thing recorded was 2 scribbles on little pieces of paper, as stated in the CNN video.
As in Finley Boyle's tragic turn of events, medication errors remain the second most common type of medical incident reported in hospitals, and all of medication errors, omissions, or overdose of medicines occurs most frequently. Reducing all errors will significantly improve patient safety and the quality use of medicines. In Australia, they use EMM, an electronic medication management system, which enables prescribing, supply, and administration of medicines to be completed electronically. EMM covers the entire hospital medication cycle, including prescribing by doctors, review and dispensing of medication orders by pharmacists, and administration of medicines by nurses. EMM reduces medication errors through improved prescription legibility, dose calculation, and clinical decision support. It enables best practice information to be more readily available to prescribers and improves linkages between clinical information systems. It can also improve efficiency in the medication management process, such as reducing the time required to locate paper medication charts or to supply non-impressed medicines. In this age of constantly evolving technology, there are always options. One of the simpler solutions is a software program developed by Nurse Anesthetist of Pennsylvania. It allows for you to input each factor of the child, including age, weight in kilogram or pounds, last time he or she was NPO, body composition, patient's hemoglobin, and their minimum hemoglobin. Obviously, with each patient, a new calculation would be needed to be entered, which is why it provides you with the space for the child's initials. This program is easily accessed from the internet and could have been used to calculate the dosage for Finley Boyle. As far as monitoring the patient, there are numerous options available to monitor a patient undergoing any procedure or operation. This, for example, is just one example of the kind of non-invasive equipment Dr. Brian Huang, an anesthesiologist, recommends for children below the age of 5 undergoing a procedure in a dentist's office. A simple blood pressure monitor and CO2 detectors could have prevented what happened to Finley Boyle. The critical errors addressed in this case were 1. Misdiagnosis, 2. Overmedication, and 3. Inadequate monitoring. To address these 3 errors, we recommend consultation with members of the healthcare team, which most often happens during planning and implementation of any procedure. Consultation could have prevented the first error, misdiagnosis. Secondly, medical staff need to remain vigilant and consistently follow medication administration policies and protocols to ensure safe medication administration. This is especially important in calculating children's medication doses, as even small errors or discrepancies in medication amounts can negatively affect a child's health. The child's age, weight, and maturity of body systems affect the ability to metabolize and excrete medications. Nurses sometimes have difficulties evaluating the child's response to a medication, especially when he or she cannot communicate verbally. Most health agencies require a nurse to double-check calculations with another nurse before giving medications. Always have another nurse double-check your work if you are unsure about the answer, or if the answer to a medication calculation seems unreasonable or inappropriate. Lastly, to address inadequate monitoring, we recommend vital signs be measured and documented every 5 minutes under general anesthesia sedation. Never assume that the further monitoring is unnecessary if the patient appears normal during the initial assessment. All right, Finley, you ready to get started? Mm-hmm. Okay. We have 5 medicines here that's going to make you slowly sleepy, okay? Okay. All right, this looks like way too much. Dr. Geyer, can you come check this for me?
Yeah, what's going on?
I think these look way too much. What do you think?
That looks like it's way too much for her height and her weight.
Okay.
It should be probably half that.
Okay.
Recalculate and let me know.
Okay, let me fix that. All right, much better. Okay. All right, Finley, you ready to get started? Okay, here we go. First one's going in, okay? Slowly gonna get sleepy. All right. And the second. Nice deep breaths. There you go. And the third. Okay, and the fourth. And the fifth. Should be nice and sleepy. All right. Finley, can you hear me? All right, Dr. Geyer, I think we're ready to get started.
All right, let's just check one more time. Finley, can you hear me? All right, I think we're ready to get started.
All right. In conclusion, we just wanted to remind everyone, there are classrooms full of future hopeful medical professionals, and we all need to remember that sometimes the smallest oversight can have very negative effects on our patients, their families, and our own careers.